Well, thank you very much to the mayor and city officials who are here, to Director Thomas and Chief Goonan. Thank you very much for your efforts and for providing us with some really good information about the local response here in Manchester. We also in the briefing had representatives of the Manchester School District, Dartmouth-Hitchcock and Elliott Health Systems, Catholic Medical Center, Amoskeag Health, as well as our first responders, our EMTs, firefighters, and police officers, and a representative of the airport. The briefing we completed gave us confidence that city and local leaders are working very closely with our state health officials, and I really want to commend the folks at the State Department of Health and Human Services for all their efforts to date. They have been working round the clock. As we know, we've seen 2 positive test results in New Hampshire, as well as 2 presumptive positive test results over the weekend. And we need to continue to ensure that the response efforts all across New Hampshire remain strong. That's why we passed a comprehensive package last week with a large bipartisan vote in both the House and Senate, signed into law by President Trump, to make sure that states like New Hampshire can continue to do the work in terms of containment and mitigation that's going to be so important to protect public health and ultimately to save lives. Dr. Chan indicated over the weekend that the new detections don't indicate necessarily a wider spread of community transition because they can trace contacts between these individuals to the second and third case. I think as we're looking here in Manchester, we need to continue to listen to our public health officials, including those from the Manchester Health Department, who are telling us to remain calm, to follow good personal hygiene measures, making sure we're doing all we can to protect ourselves and prevent the spread at the community level. Included in the supplemental funding package that we passed through Congress last week is $2.2 billion in public health funding for prevention, and that includes a provision to reimburse state and local response efforts. Also $3 billion for the research and development of vaccines, and we all know that's going to take some time. $1 billion for medical supplies and health preparedness, including funding for health centers. $1.25 billion to secure Americans' health by addressing the coronavirus overseas, and $300 million to ensure that Americans can get vaccines and treatment once they're made available so that these are affordable to them. We're going to continue to work hand in glove at the state, local, and federal levels, making sure that New Hampshire is as strong as it can be in this front. I think we all understand that this continues to be a matter of when and not if we see more cases of coronavirus across this country, including here in New Hampshire. So we want to do all we can to lift up the voices of those in the public health community, make sure that we're taking the steps that are necessary and ensuring that there's a well-coordinated response.